Hello, welcome to Hybiz News. This is Kranti Muddam. Leven Medical launches state-of-art ventilators to help COVID fight. As the coronavirus pandemic is affecting the lives of common people and the increasing number of COVID-19 cases, the government around the world have realized the huge deficit of ventilator supplies. Leven Medical, started with India-Dutch collaboration and mentored by Hyderabad Security Cluster, has come up with innovative ventilator to combat the pandemic. 3 models of the Leven ventilators, including Smart Ventilator, C5 COVID-19 ventilator and ICU ventilator, were launched by J.S. Ranjan, Principal Secretary, IT and Industries Department, Anjana Sinha, IPS, IG South Sector, CISF, Prashant Gupta and Dr. Zaki Qureshi. According to experts, prior to the COVID-19 pandemic, India had 40,000 ventilators and around 14,000 ventilators have been allocated by the government for COVID-19. However, with the current upsurge in the coronavirus cases, it is predicted that India may require 1 lakh ventilators by August, which can further increase up to 5 lakh by October or November 2020. Leven Medical conceived 3 months ago and developed smart ventilators that are integrated with AI and ML with the help of experts from across the globe. Speaking about the motivation behind developing a solution to the ongoing pandemic and healthcare need, founder and CEO of Leven Medical, Zaki Qureshi, said, with the progression of the COVID-19 pandemic, the acute shortage of medical infrastructure in the country was brought to the fore, and with it, we saw some heart-wrenching news of human tragedy. As a response, we started developing the smart ventilator and kept on adding features to bring about solutions to emerging problems as the pandemic unfolded. For instance, when we saw that doctors and medical professionals were few in number and hesitant to go near critical patients, we thought of adding a remote monitoring feature into the mission. The state-of-art ventilators, speaking at the virtual launch, Government of Telangana, Principal Secretary, IT and Industries, J.S. Ranjan, IAS. Occasion of the Independence Day, the Honorable Prime Minister spoke about Atmanirbhar campaign and got a lot more direction into it. What is happening today is a very good example of Atmanirbhar India. When the COVID-19 pandemic broke out in March, our government also realized that ventilators will be very important in controlling the spread of the pandemic, and we realized that we are in a huge deficit. And talking about the local manufacturing, Mr. J.S. Ranjan said it is an eye-opener that there is hardly any local manufacturing happening, and there was a mad scramble to procure ventilators. We also tried to import ventilators. At that time, each ventilator's cost was around 5 lakh. Given the ingenuity of the Indian innovators, there is a tenfold decrease in price now. While a lot of innovation of basic ventilators has happened, what Leven has done is a step ahead of what has been happening in the last 3 to 4 months in the terms of this indigenous development. While others are just ventilator support, but the advantage of Leven, it has also brought in a very strong dose of technology into it. Thank you for watching Hybiz News.